So we're talking about a project that was called Sweep 3, and this is the report that came out of it. Now, we initially set up the Sweep reports because we were looking for young people's voices from the most seldom heard groups. So we'd previously done some work with young people from the Gypsy, Roma and my traveller communities, migrant and refugee communities, young carers, etc. And as young people's mental health was becoming increasingly on the radar, it seemed important for us to do something around young people's mental health. But rather than we had done some work before where we were just engaging with young people, maybe who were experiencing that mild to moderate level of mental health. But we wanted, in this instance, to be able to speak to young people who perhaps had the most adverse mental health experiences, because our idea was, if we can figure out and they can explain to us their journey, we can look at how we could be doing more to do prevention and early intervention. So part of this work, and it says we're Healthwatch Essex, but we've done this in collaboration with EPA and Rochford Community Mental Health Hospital. And we were working with the Popular Adolescent Unit, which is a unit for young people aged 12 to 18. So we were speaking to young people in that age range. Most of them had been admitted due to mental health crises and was staying at the ward. Sometimes they stayed at the ward to receive treatment maybe just for a week, and others had been there for many, many months and were approaching their 18th birthday. So again, transition was something that came up there. And what we did is we worked with the education centre there, who were educating these young people because it was still term time. These young people were still quite keen to learn while they were receiving treatment over many weeks or months. And the education centre was somewhere where they could come and receive one-to-one learning in a quiet and calm environment. And through working with the education centre, we actually were lucky enough to spend several months getting to know the young people themselves by taking part in the same activities they were doing in education. So we did art together. I got to do some cooking with young people and just generally get a sense of what day-to-day life was like for those young people staying in hospital, who I think we can sometimes be a bit cautious that engaging with young people with these types of needs and safeguarding issues, we can worry that it's not a good idea for us to engage with them. But actually, by working in close collaboration with the hospital and the staff who knew the young people the best, we were able to make sure we could get their views and their stories in a way that was appropriate and sensitive and ultimately empowering for them, because many of the young people's recovery programs mentioned the need to be able to speak about their lived experience and their stories and the emotions that came with that. So actually, when I start talking about this project, a lot of people say, oh, that must have been quite sad. And yes, it was. Some of the experiences that young people shared were very sad, but ultimately it was a really positive project that I absolutely loved working on, because we're having a lot of fun and these young people were making really positive steps in their recovery due to their own hard work and the hard work of those at the hospital. So some of the key findings that came out of that report was actually for how many of the young people actually speaking to someone about their mental health in the first place might have taken months or years to bring up the courage. The next step towards getting help was the person that they told, usually a teacher or a parent, needed to first of all, believe them and validate their experience, and secondly, know what the next step would be, i.e. a doctor's appointment or what services were available. And then the third step that was really important to them getting that help was that the GP needed to know which services to refer to. And then the fourth step towards getting that help was that the service needed to have quick admissions or appropriate referrals, which we know many CAM services can have huge waiting lists. So by the time a young person's on the verge of being referred into a service, they might have already been experiencing symptoms of mental ill health for a very long time. And so many of the young people that we saw in the hospital, for them, they might have reached crises a couple of months before they were due to have their first appointment and felt very much that they just couldn't cope, on their own anymore. So things like that were really important. But we also found that while being in the hospital itself, young people were really confused by the amount of acronyms that were used around them. And when you join and you're a young person joining a hospital where there's other young people that have maybe been there for months and know the lingo and the slang, that can be really isolating and quite confusing. So all of this, we formed a report that has not just our findings and recommendations, but we produced case studies of some of the individual young people that we spoke to that really tracks their journey from beginning to end. And for these young people, you know, this kind of, for them, it was a nice opportunity to get out of just being able to do the survey or something, and be able to share their entire story, and also kind of direct us a bit about what we were asking about and talking about. So when this report was put together and published, and we checked with the education system, education centre, and the young people themselves that they were happy with how we presented our findings, we were really, really grateful and impressed with how our community in Essex carried our findings further. So that included the hospital itself and the entire trust put together a learning day for all of their CAM staff. So they're able to listen to these young people's experiences in a way they hadn't been able to listen to them before, and think about ways that they could change that inpatient experience, but also understand what some of the young people had been going through prior to that admission. For many of the young people, they were actually involved in what we sometimes call that revolving door system, where they'd been at other secure mental health units before. And there was a sense very much that when they were discharged from the hospital, the support in the community that they needed wasn't always there, which could then cause a relapse. So working with the hospital was really helpful in that, in how you put the care planning around in place to support the young people in the CAM services. We've also been really lucky to be part of an international alliance that's promoting seldom heard young people's voices being heard in health and care research. We've been able to present our findings as well to 2 select committees at our local county council, where that's been put into their own inquiries and recommendations and some of the changes that they're looking to implement across the system. We've been part of some great suicide prevention work for our integrated care system, and we've worked with the Multi-Schools Council, who across Essex brought together primary and secondary school children to do an event based on some of the young people's lived experiences around bullying, which came up a lot. And the young people that attended that event produced T-shirts and songs and posters and campaigns around anti-bullying. We also did work. One school asked us off the back of this report to do mental health days with their entire year 7s. And that was really interesting, in that we were just expecting a few young people to maybe put their hands up and ask questions, but every single person was really engaged in the session and wanted to find out more about mental health and what services were available. And we've had some great buy-in as well from the CCGs, who have turned some of these case studies into videos for their own learning and education days. And yeah, I think we've also been part of redesigning an IAPT service in Essex as well, using these young people's feedback. So really, I just think the thing I'd like everyone to be able to take away is that we shouldn't be frightened to work with young people that we might perceive as being at risk, as long as we do it appropriately and work in partnership with those who are doing a great job of safeguarding them. We can really get these seldom heard voices out there. And so I thank everyone so much for listening to me waffle on about it.